Hey everyone, Scott Gumbar, owner of Nuage Tech, Proactive IT. Should always do the full thing. It's security-minded, client-focused, proactive IT. We're a managed service provider. I call it Proactive IT, and we do a lot with healthcare. Well-versed in HIPAA, we do security risk assessments for clients and make sure that their data is not at risk and everything is encrypted and everything is secure and all those good things. We had, well, I'll do another video for that. So we did test a ransomware attack and our stack held up very nicely. Anyway, going to start a new monthly thing, a HIPAA Breach Report for the month of June 2022. I'm going to go over some important numbers. And this is going to be a monthly thing now. I usually share a image. You'll see that in the next slide. And it covers some of the highlights of the HIPAA breach report. So let's just jump into it. So for the month of, no, this is not the image I shared. The next slide will be, for the month of June, there were 70 reported breaches. And I say reported because they don't all get reported, but a good number of them do. So 70 reported breaches for the month of June 2022. For a total of 5,857,143 records breached. Now, the 70 breaches, not the highest for the last rolling calendar year, but it is the second highest. So May of 2022 was 72 breaches, reported breaches. And then July of last year and June of this year are 70. So still a pretty significant number. The 5,857,143 records reported breached is the highest in the last 12 months. So from July of last year to this year, that is the highest, July of last year being the second highest. So we are trending up again, not a good sign. This is the image I shared today as I recorded this video. So it shared it on August 3rd, Wednesday, August 3rd. And I've been sharing similar images for a while now where we talk about some of the highlights of the breaches. And usually there's 5 or 6 locations for a breach, meaning in this case, like email is one of those locations and network servers another one of those locations, and then there'll be some other stuff, usually a stolen laptop or improper disposal or external hard drives, things like that, USB drives, those kind of things, EMR, electronic medical records sometimes. And then actually this month was actually not a good month for EMR. There was, let's see if I could do some math in my head. I think it was about 20%. So it's almost the same as email. And actually, yeah, it was about the same. Email, 20%. 20% of the breaches were email. This it's lower than it used to be. Last year when I was doing this, I didn't record the videos, but I was reporting on it. Typically email accounted for around 40%. So this is down. This is a good sign. I think a lot of focus on phishing education, recognizing the risks, recognizing how to determine if an email is phishing, and putting in some methods to also alert people to potential phishing emails has gone a long way. So down to 20%, but it's still a significant number. 1 in 5 healthcare breaches is still occurring through email, most likely phishing. It could be compromised credentials. This could be avoided a lot with two-factor authentication, although not 100%. And I've talked about that before. Not going to dig into that now, but it can be prevented. There can be a significant reduction in the number of successful phishing attacks if two-factor multi-factor authentication is turned on. And then you have other things like conditional access, making sure your people know what phishing is and how to recognize it and how to avoid being phished, but also the trending methods of phishing people. And right now, current trend is using voice phishing and email phishing combined, which has a much higher success rate. 45% occur through network service. This was the servers. This was the highest number of locations. If I had to guess, I'd say weak passwords, exposed remote desktop protocols, and unpatched software. Probably all combined to contribute to this number. You'll be surprised. A lot of hacking attempts, or successful hacking attempts, are not overly complicated. A lot of times it's a lot easier than you think. And if you're not patching your software, or you're not, you have exposed passwords out there, or you have remote desktop protocol that is exposed to the world, these are all things that will cause you to have your network server breached. So almost half of all of the breaches for June of 2022 were through network servers as a location. Some of the other locations, again, electronic medical records, significantly higher number. Paper films was a low, these are the smaller numbers of breaches. Paper films, other, I'm not sure what that includes. Laptops was only 2 of them. Desktops were 2 of them. And portable electronic device, probably something like a phone or something. So, that's 5 total: laptop, desktop, and portable electronic device, most likely a phone. Smartphone, that's 5 total. And sometimes that's because those electronic devices have emails that have PHI in them, ePHI. Also, something to keep in mind, those last 3, laptops, desktop computers, and other electronic devices, if those are encrypted, you don't have to report it. So something to think about. So in total, that was 5 out of the 70. And finally, the number that's very disturbing: 57% of the breaches for June of 2022, healthcare breaches, were because of business associates. So not a covered entity. A covered entity would be a healthcare provider, like a doctor's office, a hospital, eye physician. There are eye care physicians on here. There are dentists on the list. This is business associates. This means this is somebody like my business who works with healthcare providers. I would be considered a business associate, and I should have a business associate agreement in place with the healthcare provider to ensure that I am following best practices, and I do my security risk assessment, and I'm doing what I need to do to make sure that ePHI is not getting exposed. So if I were to be breached, and then as a result the healthcare provider gets breached, and now ePHI, that's electronic personal healthcare information, is exposed, so my healthcare records or somebody else's healthcare records are exposed, that is my fault. They got in through me. I'm the responsible party. But if I don't have a business associate agreement in place, you're at fault. And so, of course, we have business associate agreements in place with anybody that we have there. Even if there's the slightest risk that some ePHI could be exposed, we have a business associate agreement in place. And so the biggest breach for business associate, is the 3rd biggest breach of the month, is MCG Health LLC. It says unspecified hacking and data theft incident. I don't remember seeing this throughout the month, but almost 800,000 records. The next one down is 90 Degree Benefits, so probably some kind of benefits. And again, this is unspecified hacking incident. Clinovate, probably some kind of software. Let's see what else, if I see anything. Dial America, so that could be, it says marketing, so I'm assuming there's some kind of marketing company. But there's a lot of breaches that are because of business associates, 57% to be exact, of the 70 breaches in the month of June. And as I'm in Connecticut, I just wanted to report, if you're not aware, Yale New Haven Hospital had data exposed on a public-facing website. I don't know what the details of that are either. If I had to guess, I'd say it's probably due to something about COVID. That would be my guess. That's happened multiple times over the last few years, where they have, some data collection for COVID, not Yale specifically, but in general. But I don't know. I don't know the details, so I could be wrong on that. So there you have it. That is the HIPAA Breach Report for the month of June 2022. As I said, beginning, we do HIPAA breach. We do security risk assessments. We'd be more than happy to help you with that. And we also provide IT services for healthcare providers, and that's not just physicians or hospitals. That's dentists, chiropractors, eye care specialists, things like that, who they're often lacking in HIPAA practices in place, and we can help with that. So give us a call. This is our contact information here at the top. Give us a call. Happy to help. Until next month for the HIPAA Breach Report, make sure you're practicing best practices.